Pleased to welcome from A Sandy Place, a holistic health services organization, Sandra Place. Hi, Sandy.
Hi, great to be here.
Good to see you. Welcome back. I think many of our viewers will remember Sandy as the administrator of the Jackson County Medical Care Facility for many years.
Yes.
You retired, but
Sorta.
Sorta. Retired from that.
Yes.
But that's one of the things that I remember when you first came to the medical care facility, you brought a new way of caring and treating the residents and patients.
Yes. It's sort of back to the basics, taking the whole organizational structure back to the basics of why we're here, who we're serving, and making their world their world. And it works beautifully. Makes people happy.
Yeah, and there's ways that people can benefit from that without meds, without devices. It's basically a holistic approach, isn't it?
It is. It's mind, body, and spirit. And we tried very hard there, and we try very hard at A Sandy Place to offer those things to people to be able to balance their life.
Your specialties, and I say specialties because you've got several, and you speak. Sandy's a speaker all over the country, delivers convention addresses, but one of the things is care for the older generation. What was your? It's always been your interest. Where did you get into that?
My grandmother. She taught me about working, about being a strong woman, about caring for others, and my family as a whole was very much about equality for people and working with everyone and supporting people to grow.
Yeah, and as we saw during the pandemic, there were those that had the attitude that, well, you know, they're old, they're going to die anyway. We can't save them from COVID. And I know that was a very troubling attitude for so many, including you.
Yes, it certainly was. And I know in Jackson here and in the medical care facilities that are across the state and the country, special efforts were made to make sure that they did not lose quality of life while they were protected from the virus with vaccinations and masks. And imagine if you're old and confused after surgery or something and you come into a nursing home and you can't even see the face of the person who's caring for you. That's pretty hard. So a lot of things were done to try to support people, both in Michigan and here, to try to make it a little bit less horrific, if you can do that with the pandemic. Yeah.
Well, yeah, people couldn't see their family. I mean, it was horrible.
Yes, it was awful.
So you have A Sandy Place. Tell us what is A Sandy Place?
Well, it's kind of got two pathways. One is my consulting business because I don't want to leave my long-term care work and my work with hospitals and different organizations in the medical field.
Here's your website, by the way.
Yeah, there it is. And there's some books that I've written and some books that a local man named Brad Williams wrote. And so they're up there. And if any other local authors would like to have a spot, they can get a hold of us at contact@asandyplace.com. Those are reference books. We do references for people so they can find resources. Those are some of my poetry. We want to help people to use expression and creativity as one of the holistic elements to relax, get less stress, to find themselves, and to be able to speak to people in other ways. That was a travel picture that just passed. That travel is also one of the things that we talk about in exploring other people and other places, because there is peace in learning in that.
And this is Sandy's new website. And JTV's David Barker put this together. Nice job, David.
Yes, thank you, David. He did a wonderful job for me.
Now we see pictures of nature, and a lot of people use apps like Calm to wind down at the end of the day. That is kind of the same technique and the attitude that you have.
Yeah, some of them. We do like online workshops, and eventually we're renovating a space right now to do in-person workshops on things like Zen drawing, which is a form of meditation where you actually do nothing but look at the form that you're looking at. Don't look at your paper and just draw. And then it is absolutely amazing what you end up with. That's a form of meditation. Teaching other forms of mindfulness meditation, aromatherapy, relaxation, how to go out into the forest and just relax. And just, there's a whole new scientific environmental studies that are based on what nature bathing can do for us. And it literally increases our ability to fight off infection and disease, which is pretty cool.
I've actually seen studies about just staring at trees waving in the breeze. It has
It heals.
effect.
Yes.
Yeah.
Yep. And there's an infinite number of ways to find peace, reduce stress, to improve your immune system without any medications at all. And I'm not dissing medicines because there's a time and a place for them, but I think we rely on them too much. And I think there's ways to be healthy and find peace without all of the traditional trappings that we've used.
Yeah, I just saw something that 70% of Americans are on meds. 60% of Americans have back pain. More than 50% of Americans have health weight issues. So we're all, I guess, potential customers, patients, clients to follow the ways that you're.
To connect with us, yes. Connection's another healer. And we got deprived of that for about 3 years. So it's kind of important to find ways to connect again and be comfortable with it. Because that is there now too. That barrier that we had for so long kind of got ingrained, and we've got to kind of relearn how to get back together and find peace with each other.
Now, do you? I know you consult and you train and teach. Do you have one-on-one in your practice?
I do, but I'm not a counselor. I'm not a licensed counselor. I have a graduate certificate in holistic health, and I have a master's in counseling psych. But I like the holistic side. I didn't want to go forward with the actual licensed counselor. I do I have met up with 2 individuals this week that had questions about death and dying and what death doulas do. So I do that, but then I don't charge people for that sort of consultation.
It's interesting. Death doula is like a birth doula, but the opposite, right?
Yeah, one is coming in and one is going out. And the going out is met with a lot more fear. And so we work with families and we work with the dying individual and try to make it as peaceful and as meaningful and as connected at the end as possible.
Yeah, and really as a society, end-of-life care, I don't think we're good at it.
Oh, we're not good here. No, we're not. I mean, we try, and our hospice groups are very, very good at those final moments, but it tends to be more on the physical side, not the lead up to death where you know you're going to die, but you aren't there yet. What is your legacy? What are you leaving to the world, to your children, to, what footprints are you leaving when you leave here? People need to recognize what they've done and to know it and to resolve issues if they have them. That's another step in that process of a healthy death. And then to come to some sort of peace with what's happening. And that's the work of the doula with the family and the person who's passing.
Yeah, and last fall my mom passed away, and that was one of the things that most troubled us, her fear. What can you do? What could we as a family do? And the answer for us was nothing. I mean, really. Yeah,
it's hard. And when you don't have the resources, and if she died a while back, it would have been additional trying to get folks in that with COVID, and that was hard too. So yeah, it is a challenge. You can help a person to find what it is because they have to resolve certain things before they pass. And sometimes that fear and that discomfort is related to that. And if you can get to the bottom of it and help that person to find that and explore that and resolve that, then you've made a huge step forward in their peaceful passing.
Well, I'm glad we have someone like you focusing on that right here in Jackson.
It's my pleasure.
It's all on the website, more information, and you can see all the resources that Sandy has and check it out at a Sandy Place. Good to see you. Thanks for coming in.
Thank you. It's my pleasure.
From a Sandy Place, Holistic Health Services, Sandy Place.